Hello everyone. So once again, welcome to MANJULA 3 Medicine. This is the second. This is from the Urogynaecology module. One more station. So here, this is a station where this is again referred by the GP. Usually GP the first contact. So they will be referred by GPs only, most of them. And I'll be grateful if you could see. He says, I'll be grateful if you could see Mrs. Lisa Thomas, 40-year-old, presented with a tender lump in the anterior wall of the vagina, 3 centimeters inside. It looks like a simple cyst. She is concerned about this cyst and want to be removed. Kindly do the needful. So this is the sting. You have to take the history, explain the management and answer concerns. Here the differential diagnosis comes because just only one cyst is there. You don't know her other symptoms and all. So you have to think about few possibilities in your mind. What could be, because it is only simple. It is the only cyst growth. Mass. So now, coming to the station, so you need to start like this. Hello, I'm Dr. Manjula, one of the doctors in the Urogynaecology clinic today. May I confirm your name and age, please? I'm Mrs. Lisa Thomas, 40 years doctor. How may I address you? You can call me Lisa, doctor. So, Lisa, I can see that you came to see our consultant. Sometimes they give like this also, that they come to see the consultant. So, you have to say like this. I can see that you came to see our consultant today, isn't it? But I doubt that I apologize for because I apologize as my consultant is away and I am doing his clinic. Would you like to continue the consultation with me? So like that you ask her. In case any station comes like this. So now that is over. She said, yes, doctor, I would like to continue. Then the other thing is now agenda. I could gather from your GP letter that you have a lump down below and you're concerned about it. Same words are given in the station. Same thing you have to repeat, concerned about it and wants it removal as early as possible. Isn't it? So, I shall address all your concerns and I'll explain to you the management plan. But I'm really sorry to say that we can't remove it on an urgent basis. We need to do some tests, confirm what it is, then only we'll be able to remove it. Will that be fine? Lisa, will that be fine? Okay, yes, doctor. So now, then, can I ask a few questions now, Yaka? You need to know, you need to know, ask a open question. So, can I ask you more, few questions to know more about your concern, which helps us in management plan? Can you tell me more about you? Okay, yes, doctor. See, doctor, I noticed one lump and down below, and so that's why I came here to consult you. So you have to ask about the lump now. When did you notice? So when duration? When did you notice? So she will say some 2 months or 3 months or 5 months, something she will say. Then you say, where is it? Where did you notice? Where is it? The lump? Then she will say in the down below, doctor. So it is at the down the area down below. Did you notice any increase in size at the end of the day? Or it's better and is it becoming less when you take rest, so you want to rule out prolapse. So is it increasing at the end of the day and is it better when you take rest? No, doctor, it is remaining the same all the time. So now that lump is over. Now other things. Pain, do you feel any pain in that? She will say yes or no. Any discharge, so tender, he said, that means it will be painful. So the DGP has says it is tender, so she will say, yes, doctor, I have pain in that. Did you notice any discharge coming from that when you press it? Because you have few things in your mind, that is urethral diverticulum. Whenever you press on the lump, the discharge will come out. That is the one diagnostic feature. So you ask, any discharge is coming out on pressing it? Yes, doctor, I notice some discharge is also coming it when I press it. Okay, any problem with the waterworks? So then you have to rule out few things in the urinary tract conditions. Like, do you need to pass urine more frequently during day? Urgent, frequency. And do you need to wake up in the night? You're asking about the ruling out the urinary problems. Night, nocturia. Any need to rush to the toilet? Do you feel any need to rush to the toilet? You're ruling out urgency. Any leak before you reach the toilet? That is urgent incontinence. No. Did you notice any leak on coughing or sneezing? You're ruling out stress urinary incontinence. Any difficulty? Is there any difficulty or burning pain when you pass urine? That is, you are ruling out urinary tract infection. Any dribble after you pass after the completion of the voiding? Did you notice any dribble? Yes, doctor. I noticed some dribble after I complete to the act. I am still noticing some dribble. So this is one important diagnostic feature. Then coming to the any did you notice any fever to rule out urinary infection? Any problem with the bowel opening? And is it affecting your quality of life? Naturally, because all the urogenic problems, mostly they will affect the quality of life. Just to ask, is it affecting your quality of life? And um, can I ask you a few personal questions? Always signpost for sexual history. Then, is there any pain or any difficulty during the act of sex? Is it affecting your? Yes, doctor, it is causing a lot of pain. That means dyspareunia. That is also a feature. Is it affecting your sexual life? Yes, doctor. So I'm very sorry to see you going through such a difficult situation. We are here to help you, Lisa. Now, can you tell me how about your periods? Like, can you tell me how your periods are? They regular? And when was your last period? So she's 40. You need to rule out pregnancy also. Yeah, it's cervical screening. So then, are you regular with your cervical screening? Are they normal? Are you using any contraceptives? So these are the normal things which you ask in a gynec history. And how about your pregnancies? Were you pregnant before? And if so, if she says yes, and then how many? A normal delivery or cesarean? How are the babies at the time of birth? How was your recovery? Then medical history. Are you on any long-term medication? For any increase for long-term medication includes diabetes, hypertension, those such things. And any allergies? Do you have any allergies? And you need to ask about the blood group because sometimes she may have to undergo the surgery, any surgery. If she undergoes surgery, we need to know the blood group also. And how about have you undergone any operations in the past? And how about the smoking? Do you smoke or take alcohol? Pardon me for asking drugs. If anything, she says yes, refer to particular center. That is a smoking cessation center program, NHS smoking cessation if she smokes, and de-addiction center if drugs. And then I say that your body, you suppose the BMI is given. You say, I say that your body mass index is, your height weight ratio is like this. If it's not given, you ask her, what is her BMI? Then, so what do you do for living? This occupation. And how was the support at home? And then, would you like to? Is it causing any? I mean, is it affecting your? Do you feel down or depressed because of this? Because she may be tense because most of the people think that it's cancer. Some people, whenever there is a swelling. So, are you worried about it? Do you need any counselor? Yes or no. Would you like to add anything? Then examination. So now that is over. Would you like to complete the information gathering? Now it's over. So now, if you borrow, if you allow, my nurse will check your blood pressure and pulse rate, and I have the examination findings with me. The GP has done the examination, and the findings are with me. And it's so sometimes they will put an image also, a color picture. They will put a Bartholin this image also. I'm sorry, not Bartholin. And so so they will keep an image also. So then so I have the things with me, examination findings, and then I will explain to you. So then no need to do an internal examination because already the GP has done. You are not so better not to do because you're not believing the findings. Now, applied clinical knowledge. So coming to the now, let me explain to you. Let me explain to you, Mercy, about your condition. So from your history, whatever you discussed with me, and from the examination findings, what the GP has provided, and also I think a few possibilities. In your case, it could be one thing is it could be a cyst, that is a fluid-filled sac in the vagina, that is down below, that is vagina, or it could be the bulging of the water bag, and or the womb into the vagina, causing this swelling. That could be a possibility, or it could be growth, and or it could be a bulging of the lining of the water pipe, inner lining of the water pipe. It could be that. That is called urethral diverticulum. So now, as you have, because Lisa, you told me that you have problem with the waterworks. That is, you have pain while passing urine, that burning pain. That is called that is for us it is dysuria. That is dysuria. You have also pain during sex when you do the sex. That is, and also there is discharge when you press the swelling. You see that you are seeing the discharge coming out. So from these things, and there is, also said that there is leak after complete voiding. So these things point out that you have a condition more in favor of the diverticulum, urethral diverticulum. That is a possibility. This is the most likely possibility. Doctor, what is it? What is that? I will explain to you, Lisa. See, let me draw and explain to you. This is the water bag. This is the water pipe, and behind these are the womb and the neck of the womb opening into the vagina. So you are drawing and showing. So here, this condition, this urethral diverticulum, is a condition where a pocket, an outpouching, it forms next to the water pipe. It is connected to the water pipe. It is coming from the water pipe. It forms an outpouching. So because of this, whenever you flush urine, it will get filled up with urine. It also gets filled up, and urine remains there for some time. So because of this, it will lead to frequent infection in the urine. So that is why you're having pain when you pass urine. Sometimes they can sometimes there can be infection of that area also, which causes discharge. And why yeah, doctor, why it forms? Why that pouch has to form? That she is asking, role player. So sometimes it's really always not known. The cause is really not always known, but it could be because of the repeated infections of the bladder that is causing cause weakening of the wall of the water pipe and cause bulging or a pocket or outpouching, or it could be a birth defect. So, am I clear so far? Yes, doctor, but is there any treatment for that? How are you going to manage? I wanted to remove it as early as possible. Yes, we can manage. I mean, so your care is managed by a team of doctors, specialist doctors called multidisciplinary team, and that is our consultant, the urogynecologist, and then the anesthesia doctor, that is the sleep specialist, the imaging doctor, and specialist nurse. So these people will be taking care of you. And then we need to do before we decide about the treatment, we need to do some tests. Like we will send a sample of urine to check for infection, to see whether you have infection or not. Okay, then Lisa, then we'll do the scan and see whether there is, after voiding, we do a scan and see whether any urine is remaining in the water bag. The third thing is we do a special imaging called MRI to rule out, to confirm that it is urethral diverticulum, and rule out other conditions. And then what we will do, we'll do this. So we'll put a camera inside. That's camera testing into the water bag and water pipe and see the inside. And then we'll confirm that the condition that you have this condition, urethral diverticulum. We will confirm by doing with all these things. Then once we confirm, we will tell you about the management. Shall I continue? Yes, doctor, tell me how you are going to manage. I want it to be removed. Yeah, let me tell you, Lisa, before removal, we can do some simple measures. But let us give the conservative management without surgery. We will offer, if infection comes out, infection comes out in the urine, we'll give you antibiotics so that that infection will get cleared and you'll get relief from the problem. And then second thing is, we will tell you to keep on pressing the cyst, that lump with your finger, so that it will not trouble you. So that is, if you then you see how who feel. If you become better with this, you can manage with this. Isn't it, Lisa? Yes, doctor, but if I'm not better, then what to do? If you're not better, the other next option will be surgery. That is an operation. Shall I explain to you about the operation? Yes, doctor, tell me what you're going to do. Then, if you're not better with this, we will go for the surgery. But it is done in the tertiary hospital. That's where the specialist doctors are there. That is a urology center. We will refer you there, and it is done by the specialized team of doctors who are specialists in this. So that is their experienced surgeons, the experienced urologist. It is done under sleep medication. They will be giving you sleep medication. It is done after putting you to sleep. How is it done, doctor? Yeah, we will pass a small telescope into the water pipe and allow the water pipe into the water pipe and into the water bag, and a small water pipe, and a small cut is given. A small cut is given into this sac bulge, this lump, that is the sac. It is a small cut is given. It is separated from the water pipe like this. You draw the diagram, no? You show on the diagram. So it is separated from the water pipe and it is removed completely. And so see, this gap forms. Once it is removed, a gap is formed. It is closed. It is closed by stitches. And this is the best treatment for this condition. So that is the best operation. and then success rate is 7 out of 10 will have complete relief. Uh, but doctor, is there any problem with this operation? Yeah, I'm telling you, you will get relief from this thing, but there can be some risk also, which I'm going to tell you. But after that, we will put a tube, that is a catheter. We will put the tube inside into the bladder, that water bag. It is kept for 2 weeks, almost 14 days. And also, we will advise you to avoid intercourse for 6 weeks, because that has to heal. And then you need to avoid strenuous activity, heavy exertion. You have to avoid for 4 weeks. But after 3 weeks, you can go for your work. So this is what are the risks? Let me tell you, there are some risks from the operation and also from the anesthesia. So the risk from the operation can be bleeding. When we do the surgery, there can be bleeding. Then after the surgery, there can be a repeated urinary infection in the water bag, in the urine. And also there can be urine can come out leaks when you cough and sneeze, or it can come back. This same problem can come back again, or there can be some abnormal communication. So that is called fistula, or it can water pipe can get narrowed also. So these are the problems which we can expect with the operation, but our team of doctors are there to manage. So, doctor, then you don't do any surgery. I don't want any surgery. Why don't you? I will just be like this. Will that be fine? No, see, Lisa, if it is not treated, then there can be some problems. There can be some issues. Like frequently, you'll be getting infection in the urine. Then you have this problem of leak whenever you cough and sneeze. That will cause embarrassment for you. It will affect your quality of life, and there can be some stone formation, and they can get infected. It can get infected, and pus can form, and then we have to do surgery. And for last, some chance of it becoming cancer also is there. So Lisa, if we advise you to think about it, think about surgery. First, you can do the simple methods, then not better surgery. So then, one more method, we can have another small method, that is, we can cut at the neck of the sac and create a permanent opening into the vagina. That also is a type of surgery which we can do. It is a simpler one. So, am I clear so far? Yes, doctor. Now, do you have any concern? Any concern? No, doctor. I'll discuss with my partner and I'll come back. I will decide and come back, doctor. Yes, that will be that will be fine. I'll document whatever we have discussed. I'll give an information leaflet, written information leaflet about this condition, about what we have discussed. You can go through it and you can discuss with your partner. And I'll give an appointment with my consultant. So come down and meet him and tell your decision. So whatever you decide, we will respect it. So then, if you permit, I'll write back to your GP. I'll connect you to the support group also. So then, thank you, Lisa, for your time.